The British government has sharply condemned when another 4-day strike by hospital doctors in England was announced. The strike would only harm patients and put even more pressure on your own colleagues. That's what Health Secretary Steve Barclay wrote in an op-ed for the Daily Mail tabloid, and he called the walkouts negligent. The dispute between young doctors and the government has been going on for 8 months. According to the British Medical Association, the BMA, the salaries of the junior doctors, who can bring many years of experience to the table, have not kept up with inflation for a long time. Accordingly, these doctors have had to accept a real wage loss of 26% over the past 15 years. In return, they are now demanding full wage compensation, which is intended to restore the purchasing power of 2008. However, the government so far rejected this as too expensive because it would correspond to a wage increase of 35%. The government refers to the fight against the still very high inflation in the country, and their offer amounts to a salary increase of 5%. "We are chronically understaffed and everyone is on the brink of collapse," said junior doctor and strike activists Sumi Manirajan. "It's primarily about the salary because we don't know that many of our colleagues are changing countries or industry simply because the salary is too low to keep doctors." That was said by Robert Lawrenson, who was also on strike in front of the University Hospital in central London. The junior doctors make up about half of the hospital doctors in England. The 4-day walkout was the 5th wave of strikes by English doctors. According to calculations by the NHS Providers Association, the industrial action has already cost the National Health Service (NHS) the equivalent of around €1.1 billion. Similar strikes in April and June led to massive disruption, with hundreds of thousands of appointments and operations in hospitals having to be postponed. Nursing, service and special staff, as well as the more experienced doctors in hospitals, known as consultants, have also joined the protest actions for better working conditions in recent months. The NHS already has a gigantic backlog to clear after the corona pandemic. And according to the BMA, around 3 million people have been waiting for a treatment appointment for more than 18 months. According to the latest figures, a record 7.6 million patients were awaiting routine treatment in English hospitals in June. When it was founded in 1948, the state-funded NHS was the world's first comprehensive health service open to all residents. However, it has been underfunded, overburdened and heavily indebted for years. At the end of June, British Prime Minister Rishi Sunak announced that he would hire more than 300,000 specialists over the next 15 years to deal with the health crisis. The NHS is in bad shape. As I said, it's overburdened, underfunded and understaffed. The NHS faces a number of challenges. An aging population that has greater need for healthcare services, an increase in chronic diseases such as diabetes and heart disease, an increase in mental health problems, a shortage of skilled workers, especially doctors and nurses, and of course NHS underfunding. But there's also an overload of the emergency rooms and waiting times for treatments. And as I said, the government has announced it will invest £12 billion into the NHS to reform and strengthen it. But it remains to be seen whether these measures will be enough to meet the challenges facing the NHS. And the £350 million a week still haven't come. Real wages of NHS workers have stagnated over the past 13 years, and this means that their wages have not increased at the same rate as the cost of living. And this has created a financial strain on NHS staff who are no longer able to cover their living expenses from their wages. A 2022 King's Fund report shows that real wages of NHS workers fell by 10% between 2009 and 2021, and this corresponds to an annual loss rate of 0.7%. And the report also shows that real wages for NHS workers have risen at a slower rate than real wages for workers in other sectors over the past 13 years. The stagnation in real wages of NHS workers has a number of negative consequences. It has led to a shortage of skilled workers as NHS staff prefer other higher wage industries. It has also led to an increase in overtime and stress among NHS staff. And it has also led to a deterioration in morale among NHS staff. So that will not be very helpful, especially after the pandemic. But you can see that the real wage losses correspond with the time the Tories are in government. And so I don't think that this is really a coincidence. You will be a bit surprised there was a little bit shorter video today, but sometimes a topic is so important that I also bring it in the morning, even if it's a shorter one, because that is a topic. I know not as many people as usual will watch this video, but I think it's really important to keep this topic on the list because they deserve better. And I'll see you in my next video. I'll be back.